A lot of times people ask us, what are the checks we've got to look for when we want to make sure our bladder is in good health? So we came up with a really nice topic called the top 10 tips for bladder health. Are you ready? We're going to count it down from 10 to number 1. So number 1 is get your prostate checked on a regular basis. So if you're 45 and have some problems in prostate cancer in your family, make sure you get it checked. If you're 50, no prostate problems, no cancer, that's the time that you're going to get checked. All right? Get your prostate checked. Why? Because if that prostate acts like a nice little tap and it squeezes too hard on that urethra, you're going to have problems with that bladder building up your urine inside it, and the bacterial levels will rise, and you end up with all kinds of different problems with infections. All right, what's number 9? Weight. All right, we're going to put that on here. All right, why are we so concerned about weight? If you're carrying more weight than you should, you could have problems with your prostate again. You could also have problems with diabetes. What you want to do though is get down to a good weight for yourself based on your height and your body type and your activity level. That's important too. Okay, number 8 on our list, irritants. All right, irritants are any of these things that exercise your bladder. It gets it too anxiety ridden, if you will. So what could that be? It could be alcohol, it could be orange juice, it could be caffeine. It's anything that's gonna cause a problem for it. You know, it's just, you ever had too much caffeine in your system, a lot of acid in there? You want to stay away from that. The bladder doesn't like it so much. So, get something else to drink. Maybe we should go to number 3 real fast because that's important. So number 3, and I'll come back to the rest of them, water. Drink water. Lots of water, okay? Stay away from the irritants. Get the water. Help flush your system. All right, let's go back. Okay, number 7. Go when it calls. When you have to go to the bathroom, man, don't hold it back. Go for it. So go when you need to. All right. Number 6. This goes back to irritants. Stay away from the caffeine. Caffeine is an irritant. It's just going to bother you in all kinds of different ways. Plus, it's a diuretic. If you want to maintain that water level in your system, this is going to pass it out. You say, wait a second, Van, you just told me to go to the bathroom when it calls. Yeah, well, you don't want to force it. You don't want it to be an irritant. All right, let's keep going. Number 5, exercise. Make sure you get enough exercise in your life. Why is that important? You know what exercise is going to make you do? It's going to make you drink more water. Is that a good thing? Yes, it's a good thing for your body. It helps cleanse that whole bladder area and the urethra and everything else that comes along with it. Okay, so exercise. Exercise a lot. Plus, let's think about this. Helps kill those anxieties. You get rid of all that excess tension. You know, you raise your heart rate a little bit. You get your lungs big and strong, and you feel like $1 million. And I'll bet you $10 you'll sleep better too. All right, number 4 on our list. Stay away from the alcohol, or at least govern your consumption. Okay? Alcohol is just another irritant, and like caffeine, it's a diuretic. All right? It's forcing your body to get rid of that water before it can use it. Okay, I already talked about water. Number 2, this is a biggie, folks. Don't smoke. Wait, smoke? Water? Wait, that's lungs, bladder. What? How is that connected? Here's why. The number 1 cause of bladder cancer is smoking. You don't want to ever have to deal with that disease? Don't start or quit smoking now. Just stop. I used to say, just say no to drugs. I say, just say no to cigarettes and pipes and cigars, whatever else is putting that stuff in your system. No smoking. Okay? No smoking. Let's forget it. All right. We've gone down 10 through 2. 10, watch that prostate. 2, keep your weight down. 8, make sure you're not putting more stuff that's bothering you in your system, better known as irritants. Okay? 7, go when you have to. 6, drop the caffeine or limit the caffeine. 5, exercise. Exercise is just a general good rule all the way around. 4, drop the alcohol or limit it. It's just another irritant in your system. The bladder can't handle all that much. You put alcohol and smoking together, you're on your way to bladder cancer. All right, number 3, flush the system. You can't flush it unless you have water. And of course, I already said don't smoke. All right, so you're asking yourself, Van, but what's the number 1 thing that we should be doing? Okay, you want to know what the number 1 thing is? Here it is, folks. Pay attention to the signs of prostate health. If you're bleeding, if you got blood coming through your urine, or you might have, bathroom issues, like at night going 3 or 4 times, or you feel bloated all the time, or you get UTIs all the time, man, there's something going on with that bladder. Take care of it. Watch it, because it'll be watching you.